Hello, I'm Jonathan from the YMCA, and it's a pleasure to have you with us today. This has been Mental Health Awareness Month, and so throughout the month, we've brought you different presentations related to the awareness of our mental health and well-being. I'm very fortunate to have guests today from NAMI that are going to speak to really the resources that they bring through in San Diego, and an array of incredible digital apps that make those resources available to us in real time in the palm of our hand or on our desktop. So I am very fortunate to have with us Mina Arthman and Melissa Penafor from NAMI. Welcome. Thanks for being with us this morning.
Thank you.
My pleasure. If we could start with, if you could share what NAMI is. Obviously, some of us may know it's a national organization, but let you share all about NAMI.
Yeah, so we'll get more into this in our presentation, but NAMI we are a grassroots organization. So we are here working on the ground floor to basically help support families and individuals living with mental illness. So either a family that has a loved one that's living with mental illness, or if you yourself are a peer and you also live with mental illness. Almost all of us at NAMI identify as a family or as a peer, and we do support groups, we do different programs, and our goal is to support, educate, and advocate. So we're here to basically be of assistance to the community and be a voice for the community.
That's fantastic. I really appreciate the work that yourselves have been doing. I recognize that during the pandemic, there has been great impact to our mental well-being. There was a talk early on, some experts spoke of that the second pandemic would be a mental health pandemic. And we've seen that come to fruition. So I appreciate that we're going to be talking about resources that all of us can tap into, whether we're caregivers, family members, or a peer that is challenged in that particular way. So if you will, where are we off to? How would you like to start in terms of sharing about the resources available locally here?
Sure. We have a presentation, so I'll share it right now.
Fantastic.
Alrighty. So again, welcome everybody. This is going to be your guide through NAMI San Diego and Imperial County's programs and apps. Again, my name is Mina, so nice to meet you. And I am the CYFL lead trainer, and my wonderful co-worker is Melissa, and we're both here to help give you this presentation.
Wonderful.
So again, what? I'm sorry.
No, wonderful. It's great to have you.
Oh, thank you. So to give you a little history of NAMI, so we actually started in the 1970s as a parent support group. So if you're familiar with history at the time, mental health and mental illness was not seen and handled well, right? So these parents didn't like the way that institutionalization was felt like the only option. So they started around their kitchen table. Their children were living with what would later be schizophrenia. And they really wanted to connect with the community, connect with other parents. And in 1979, they became a national organization. And then in 1984, NAMI San Diego became an official affiliate. And we launched our helpline that is still around today. And we are actually one of the 5 largest NAMI affiliates out of 950 nationwide. And then for Children, Youth, and Family Liaison, we were funded by the Mental Health Services Act, and we work as a link between the community and the County of San Diego.
Great.
So our mission statement is to support, educate, and advocate. So we support those living with mental illness and their families and their loved ones. We educate the public like we're doing right now. And then we advocate. So we are always looking at more research. We're looking at how we can best support and destigmatize mental illness.
Mina, does some of that advocacy go into legislation so that there are more grants and more opportunities and funding that comes into the space of supporting mental health?
On our level, for our team, we don't, but there's definitely, that's more like NAMI National or NAMI California. So on the way that the NAMI is structured, you have NAMI National, then you have the different states that branch out, and then from there you have the different affiliates. So upper work tends to be handled by the bigger part of the organization.
Makes
And
sense.
then we're more direct with the community. So here at NAMI San Diego, we might not do that much. But individuals you might see them doing, talking about different like different things involving politics. You might see them out and about advocating in that sense. And then we do have different like presentations that we do that to kind of help destigmatize mental illness. And I think that always works to help talk about it more politically.
Yes.
Yeah.
Great.
And we do have our clubhouses, and I'll actually pass that over to Melissa.
So
Hi.
Melissa,
Yes. So NAMI San Diego.
What are the clubhouses? I love the concept of it. Just as a title, it's attractive. What are the clubhouses?
So NAMI San Diego has 3 clubhouses. One is in San Diego, and that one, they actually help individuals who are homeless or have housing insecurity, who have mental health concerns, and they provide them with in-house resources, case management, outreach, referrals. They give them support in accessing mental health and housing services. So like if you want to learn more, you can call this number, or you can email clubhouse@namisd.org. We also have 2 more clubhouses, and one is in the Plaza Chula Vista, and the other is in Casa del Centro in Central San Diego. And both of those clubhouses provide services for individuals who live with serious mental health illnesses and or co-occurring disorders. So that's like 2 disorders at the same time. And these clubhouses, they just provide support through Social Security, advocacy. They provide employment assistance, nutritional education, peer support services, case management, and they give those people opportunities to grow in their community where they can feel safe. And if you want to reach the Plaza, you could call this number that's listed, or you could email the Plaza clubhouse@namisd.org. And to reach the Casa del Centro, you could call this number that's listed or email casadelcentro@namisd.org. So there's like 2 different ones, one for homelessness and 2 for the serious mental illness and or co-occurring disorders.
So Melissa, is this available to anybody then, or do you need to qualify in some way? Because that's an incredible resource.
Yeah, well, the one for the homelessness and housing insecurities, that's of course only for those individuals in that category who have mental health concerns. And then this individuals with serious mental illnesses and or multiple disorders, I think those aren't they for 18 and above, Mina?
Yeah, so our clubhouses are for adults. They're for those 18 and up. And they actually just work as like a direct link to the community. And so actually yesterday I just referred someone who is needing help with their daughter with housing to reach out to them. And so it's a great place to go if you're looking for resources, and they basically are there to serve you, and they are open, to anyone that can make it there, basically. Yeah.
That's fantastic. In this time of equity and access, often those with mental illness, those that are living without a home, it's very challenging to get services. And so it's great to see that this is an opportunity that's available, a resource that's available.
Yeah, our clubhouses are a great place to go. The staff is also amazing, very understanding, very enthusiastic. So, if you're looking for help and you're looking for someone to talk to, the clubhouses are a really great place to go.
Great.
Yeah.
So we also have the independent living homes in San Diego and Vista, California, and they also provide affordable housing that creates like safe environments where a person can thrive and promotes wellness with people who also have mental health conditions. and you could email isla@namisc.org. So these pictures are actually real pictures from one of the women's independent living home for like 5 women. And there's this YouTube video if you want to see more of this beautiful house. You could just go on YouTube and put independent living homes, and then one of the workers from NAMI San Diego would walk you through this house and like all the components and everything. She said that this specific house had 5 ladies that all shared the home, and she was the one that worked there. She lived with them and she oversaw them and like made sure that they were in a wellness environment that promoted wellness and a safe environment. And so this was just one of them, and I think all their homes are kind of group home settings, but they are beautiful.
How impacted is this system? Meaning, I know we're encouraging people to access these resources, whether it's finding mental health resources, whether it's finding housing. If someone was to make contact today, is there availability? Is there a wait list for the array of services?
Yeah, so there's definitely going to be a wait list, and that's across the United States. Unfortunately, mental health support is impacted. And that's something I think nationwide we need to address through our politics, through our advocacy, through our voting, right? But it never hurts to at least try. It never hurts to get your name on a list. It never hurts to call, send an email in. The more you can advocate for yourself, the better your options are too, or you can advocate for your loved one. So the current, how many people live there, that's not information I have, but it never hurts to just email if you think this is a good situation for you or a good situation for a loved one, because maybe we don't have a spot open, but they can refer you to someone else.
I appreciate what you're saying, because it lets us know that there is demand and we're not currently able to meet that demand across the country. And so we should be looking at how else to provide greater access in this space. So I appreciate you sharing that. Thank you.
And honestly, we're very lucky here in San Diego. We have a lot more resources here compared to other parts of the country. And we're able to meet a little bit more of that demand compared to others. And I'm very grateful for that here. I'm grateful for people that vote that way and advocate that way. So I appreciate that. I'm glad that we're here to help more.
Excellent.
So we also have Next Steps and Peer Link. So Next Steps provides clients and family members who go to the emergency psychiatric units, the EPU, and designated mental health clinics with on-site support and assistance with resources for successful recovery, and helps them re-enter into the community. To find out what specific mental health clinics they are, you can go on their website, the Next Steps NAMI San Diego, and they will just provide you the list of the health clinics that they serve and the emergency psychiatric units that they serve, if you're interested to knowing if the hospital or health clinic that you go to provides steps for next steps. And Peer Link San Diego County provides support for individuals who are 18 and above, who are released again from designated hospitals and crisis programs. They just give them support and assistance for up to 6 months. And to learn more, you can contact peerlinks@namisc.org, or you could also go on their website, Peer Link San Diego, and you could find out all the designated hospitals and crisis programs that they serve. I went on and they said, they just listed out all the names that they had of the centers, like the UC San Diego and New Vista, Vista Balboa, and Skip Mercy. And it just tells you which ones that you can get services from them if you're interested. And the Peer Links in Pio Valley, they are different from San Diego because they provide peer support and AOD, which is alcohol and drug counseling services. So they provide like case management, care coordination, education, family support, and more. And like if you're interested, you can contact Peer Links Imperial Valley at namisd.org or go on their website. And the one distinction between Imperial Valley is they only serve individuals 18 and above from Imperial Valley. And if you're interested in what Imperial Valley contains, you can look it up on the website, and they say all the counties in Imperial Valley. And San Diego covers all San Diego for Peer Links.
What I really like about what you just shared, Melissa, is that it shows the continuum of care. So there's the crisis, the acute stage, and then it's the follow-up and supports through stabilization and reintegration. And that's so important. Often we treated at the crisis, and then we're not there to provide the follow-up care. And so it just lends itself to being repeated without support. So this is excellent.
Yeah, the Peer Links program is awesome because it pairs you with a peer support specialist, someone who's been through what you've been through, that understands what you're going through and is there to help guide and share that lived experience. And back a little bit to politics, now that we're going to be certifying peer support specialists, that field is going to be growing. So there's going to be more opportunities and more peer support specialists out there being able to help, just like with Peer Links.
Fantastic.
Yeah. So we also have our support groups here at NAMI. So our main ones we have two different types. We have our family support groups and we have our connection support groups. And our family support groups are for those that have family members or caregivers, and you take care of somebody that's living with mental illness. And so if you're interested in those, you can access all of those on our NAMI calendar, and you can also email f2f@namisd.org. We also have our NAMI connection support groups. So these are also peer-led, and they are for peers living with mental illness. So a little example is I run the Women's PTSD support group, which is the first Wednesday of every month. And so that's for women that live with PTSD, and it's a place for us to come together and kind of talk about what we're going through and help support one another. So we have so many different support groups, and they're always growing, and they're really wonderful places. I really recommend them. It's a great place to come if you just need that support.
So peer-led, Mina, you have experience and probably professional training and exposure and whatnot. Are others that are aspiring to be a leader of a support group, do they get training if they're interested in volunteering and offering their experience in a particular way?
Yeah. So all of our groups are run by two trained facilitators that are peers or family, and because they have that lived experience. And if you're attending these groups and you're interested and you would like to, you can reach out and sign up for the next training to see if you're interested in becoming a facilitator as well.
Great.
Yeah. So we also have our family to family, and our family to family, it's a class. So they're a set of classes, and they kind of go over a big range of information involving mental health and how to support a family member that's living with a mental health crisis situation, or living with mental illness or going through a crisis situation. So family to family, I'm currently enrolled in them. They're wonderful classes, and they're really, like, let's say you didn't take psychology as your major, or it's been a while. This is a great rundown of everything related to what you need to know to be a wonderful first step in supporting a family member. So they're really great classes. And again, if you're interested, f2f at namisd.org. And then we also have our career pathways program. So like I mentioned, peer certification is now becoming a wonderful thing across the United States, especially here in California. And so we now have training programs to allow you to become certified as a peer support specialist. And so the program that we have here, the classes we have here at NAMI San Diego, are our career pathways program. And so they provide a lot. It's a 40-hour online training. There's 16 different classes. You have 6 months of follow-up support, and they help you with career placement as well. So we are really excited about this, because not only will you have your clinicians and your doctors, and you will have, support groups, but now we're also going to have peer support specialists that are involved in that healing process and that recovery process as well. So it's just another wonderful avenue.
I think that's so important, because often there is the experience of, you're working with a clinician, but someone who has actually been on the journey and is walking that path
Mhm.
what they can impart, hope and resilience is critically important.
Yeah, exactly. You are able to connect with somebody that is not giving you prescriptions or you're having one-on-one therapy with. It's more of that understanding. And even if a lot of therapists and clinicians also have their own lived experience,
Sure.
the way it's handled is different, and that's just due to the nature of it. So it's nice being able to have somebody to be that support system for you.
Important point. Thank you.
Yeah. And then we also have Elevate Youth California. So Elevate Youth California is geared towards our TAY, so that's transitional age youth. That's like middle schoolers up to young adulthood. And they do a wide array of different presentations and programs. One of them is their student self-leadership program, where it's 5 classes where they work with TAY on how to become successful leaders in the community and become mental health advocates. They also work to do opioid overdose prevention and response trainings. They tackle teen depression. They do suicide prevention. So Elevate Youth California is an amazing program. If you have a youth group or you have a class or a school club that's interested in having them come in and do their presentations and their trainings, you can contact Karen Leon at NAMI-SD.org. Yeah. And then we also have, oh, sorry.
I'm making notes of that. We opened
Oh,
up
yeah.
a teen center in the spring, and first day we had 40 teens just show up and walk in the door without any marketing. And so there is a desire and a need to come together as community and have support in a safe place. And I would think something like this would be very helpful in terms of education and just that shared understanding what
Yeah.
they're going through.
I definitely think, yeah, reach out to Karen, because I think the our EYC program would love to be there and help you
Great.
all.
Thank you.
Yeah, you're welcome. We also have our NAMI in your own voice. So these are presentations geared to like sharing the lived experience and talking about recovery and talking about what it's like having mental illness or living with a mental health condition. And it's all from our own voices and our own perspectives. So if you're interested in having a presentation from an in your voice speaker, you can reach out to IOOV@NAMISD.org.
Thank you.
Yeah. And so back to the resources, some of my favorite things that we provide is we have different phone lines. So we have a resource helpline that's that's 9 to 5, Monday through Friday. So if you're going through a situation and you just need maybe you need some housing assistance and you want to know what's out there, you want to know about the different psychological support out there, like psychiatric support, different hospitals, you just need some resources. That's a great response resource helpline to reach. And then we also have our peer support peer support warm line. And that is 7 days a week from 3:30 to 11 p.m. where you can call and be paired with a peer support specialist. And then we also have our text line. I always love our text line because this is a great resource. We joined up with the National Crisis Text Line. So you can text NAMI to 741-741. And with this text line, it's a great option for youth. Not all of them are really comfortable like being on the phone with somebody. Younger generations are leaning more and more towards texting. So this is a great option. Like if you have a young adult that maybe was like support, but is not comfortable calling a resource line, they can reach out to the crisis text line.
I love how your resources meet people where they're at. As you spoke of just the array, it's so impactful.
Yeah, I appreciate that. And so something else exciting that's in the pipeline is 988. So back to addressing mental health on a nationwide perspective. So you'll have 911 and you'll have 988. And 988 you can call, text, or chat starting July 16th, 2022. So it's right around the corner. And you will be connected to trained counselors that are part of the existing National Suicide Prevention Lifeline Network. And it's a place for you to call and talk if you're going through a mental health crisis situation or you need support. And it's going to be a really wonderful way that we're going to nationally tackle mental health and provide mental health support for everyone.
how does that word get out? I mean, obviously NAMI yourselves are doing education like today.
Mhm.
How does someone who is just out in the community find these resources or become aware of it?
So from Google, from following social media, from definitely follow our NAMI San Diego social media. You know, you can follow the National Suicide Prevention. That's where I get a lot of my information, is from social media, which
Sure.
you know, a lot of us do now. And so that's one way to stay in the loop. There's different like newsletters that go out that you can sign up for from different organizations. And that's, oh, those are just two ways that you can, yeah, hear more about the updates. Yeah.
Excellent. I know we only have a few moments left. And you have quite an array of resources. In our few minutes left, what would be most important to share? I know you have some digital apps as well.
Yeah, so here, let me stop screen sharing for just a second and I'll go to that slide. So we have 3 different apps here at NAMI San Diego that we provide. So our first one is Oscar. Oscar is your guide through navigating a mental health crisis situation within, and it's geared towards everyone within San Diego County. And it is in 6 different languages, English, Spanish, Arabic, Farsi, Vietnamese, and Tagalog. And you can download it and access it on a browser, or you can download the app directly on the different app stores. And we also just did a sud enhancement to it. So now we have a whole new section of the app that talks about all of the different information and resources related to substance use disorder. But one of the wonderful things about Oscar is it provides that direct link. So if you need to call a place from the app, you can do it from the app. If you need to like find direct information, you can, there's a little search feature and you can see what information, you can like look up diagnosis or naloxone and you can see what that means. You can look up different terms and acronyms, and it's all of that information in one app for you directly there. There's also a wonderful relax feature. So if you need to listen to some calming sounds, you can use the app as well. And then we have Oscar Jr. It basically takes the children, youth, and family component of Oscar and puts it in its own app. It is currently only available in English, but it will be coming soon in different languages. And then we have Alfred U. Alfred and U is your guide through navigating the education system. So that's like IEPs and 504 plans. And while Oscar and Oscar Jr. are geared towards San Diego County, Alfred and U is geared towards all of California. So it's for everyone within the state, and it provides direct link to resources within the different schools within California.
Well, I am impressed just with the array of services, resources, and again, how you're continuing to be relevant in this space in terms of just meeting people in a variety of different ways. Very, very impressed with everything. Anything that you'd like to share in closing? I really appreciate everything you've shared with us.
Yeah, I think NAMI is here to really support you. And we have a wide array of different resources, and definitely check out our websites, check out our social media. And if you're going through a crisis situation, know that like you're not alone, that so many of us will go through that. If you live with mental illness, know that there's a whole place with over 100+ employees that also have lived with mental illness. And so know that, you know, we're all in this together. We're all here to support one another and be advocates for one another and educate and all of that good stuff. Yeah.
Well, Mina and Melissa, I really appreciate what you've provided today, the education and the resources, and also just the comfort in terms of you know, asking, you know, those of us to just enter in and make sure that these resources get shared with others. So impactful work. I greatly appreciate the service that you provide in this space. It's supporting people in their mental health. So thank you very much. Wish yourselves well. And for those that joined us today, please share about NAMI and these resources. And until we meet again, please be well. Thank you very much.
Thank you, everyone.
Bye.
Bye. Stay safe out there.